The following show and its content are the responsibility of the show's producers and participants.
Information related in this program is not meant to substitute medical recommendations. Before starting a treatment program, you should consult your physician.
T-minus 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Ignition. Liftoff.
That's right. Welcome to the Couch Live here on the Problem Solving Network, WPSN99.com, here at the Surf Monkey Studios in New Smyrna Beach. I am the Street Certified Dope Doctor, Lou Delgado, here with you, like I am every Friday. It's a beautiful Friday here with my cast of friends, and we got a full cast today. Everybody's back from their little days off vacations and studying.
No more biology tests.
No more biology tests.
Organic chemistry.
I'm sorry. Excuse us, Grasshopper.
Get it right.
Get it right. Organic chemistry class. So, again, my partner's here, so you know him. That's the Dharma Guy right here. Hello, Dharma Guy Trinity Phillips.
What's going on?
Hello. And, of course, we have the Grasshopper. How you doing, sir?
Good to be back.
Yeah, welcome. That's Robbie Barrett. And look, Rob, look at the shirt Robbie's got on.
I like it. I'm digging it.
I do too.
And I got the matching wristband on too. Now all I need is a hat, and then I'll have all the swag.
There you go. Wow.
Yeah. I may have one for you.
Awesome. I'll wear it.
I had one extra that I always save because remember they get dirty. We knew they were white.
Yeah.
So I took two.
Yeah.
And I only took one.
And one's like yellow, and the other one's brand new white. I haven't worn yet.
I haven't worn it either. But it's still in the plastic, and I would be willing to part with it, Robbie.
Wow.
Because you've done that good of a job.
That means a lot to me.
You've done that good of a job.
Wow.
Plus, you paid for a Kyle Weatherman shirt that I still haven't given you, so...
Oh, wow.
Kind of owe him a hat.
I thought this shirt was kind of the substitute for that.
No, you're still going to get the Kyle Weatherman shirt.
And speaking of Kyle Weatherman, did I see that he's on the Cup Series
Oh,
now?
my God.
Did I see that right?
Did you see that?
Is that the big dogs, right? That's the... I'm not a NASCAR aficionado,
That's as big as you get, Trinity.
Wow.
That's as big as you get.
Very, very cool.
Our own Kyle Weatherman.
I am very proud of him, man.
Is going to be driving in the Cup Series. What is it? Martinsville, I think is what it was.
Yeah, something like that.
Right?
Very cool.
And then, of course, welcome to everybody on Facebook Live, Trinity. There's some people on there for you to communicate with while we're doing this, right? Hello to everybody out there.
Sure.
Trinity will be communicating with you while we're on the air. However, we'd rather you listen to the show currently live at WPSN99.com instead of listening on Facebook Live, because it obviously different quality of sound when you listen on the radio, and then you can watch it on Facebook Live. You could always do that, right, Trinity?
Yes, sir.
And then, so make sure to go to WPSN99.com if you want to listen. Now, of course, thank you to Aquarius 7 Broadcasting Network, because we're also on their network of shows, so you may be listening if you're tuning in on rock100diz.com or on WJHM 102jams.com. Hello and welcome. So I think I said a thank you to everybody, just about. And, of course, it's brought to you. Whoa, there was a pop. It did pop. This is such a good...
It's popping.
This is way too good of a microphone. I haven't had a microphone pop. Whoa. I haven't... I'm going to have to get that pop now. I didn't want to put that on.
Well.
Because you don't hear the pops anymore, you know? But I guess this dog right here does. Anyway, this show is brought to you by not only this show, but the entire... Problem Solving Network is brought to you thanks to the good folks at Journey Pure. Journey Pure is an addiction treatment center, and they have several treatment facilities throughout the United States, including Tennessee, Kentucky, Florida. They know what they're doing. They do it right. We have vetted them when we do stuff with the Now Matters More Foundation. We're so happy with everything they do there. Matter of fact, the Now Matters More Foundation just put another person there at Journey Pure the other day.
Nice.
So thanks to them for taking care of him. And then another one of our major sponsors is Retreat Premier Addiction Treatment Center. Thank you very much to Retreat Premier Addiction Treatment Center. They're another fantastic program. They have programs up in Pennsylvania and Florida as well. So thanks to them. Another great program. So if you or any of your loved ones have any issues with substance abuse, and we touch on any kind of subject that may, just tap a little bit personal to you while we're talking, we joke around a lot. We do a lot of different things. We don't always stay on topic or on task.
Not us.
No, not
never.
Us. But if we touch on something and you want to talk more about it, or you think that you or your family member could use a little bit of extra attention, then either go to our sponsors, that you can find them by going to WPSN99.com, or contact us at nowmattersmore.org, and there's an entire list of vetted programs there as well. So, all right, let's get into it. Trinity, there's a lot of stuff, stuff in the news, and Robbie, you wanted him to do it.
Yep.
You asked for it, right?
Oh, yeah.
Was it what you wanted? Let's talk about what you wanted, and let's talk about what it is.
Well, what I wanted is funding and the money to go to the right place.
Show me the money.
Yeah.
Money.
But I think the one thing that really stood out to me, the first thing, was that this rule that was implemented in 1970
let's talk about what we're talking about.
Oh,
first.
yeah. Okay. For anyone who
set it up.
For anyone who didn't hear, the Trump administration, and Trump specifically, yesterday declared, is it a national state of emergency or a?
No.
Okay.
No, it's I wrote it.
A public health.
Health.
Public health crisis.
That's right.
Yeah. So it's a little bit different than a national.
And the difference is right there. The difference is it's a 90-day
right
issue. Yeah. Okay. So here's the thing. Before anybody gets frustrated. So the main thing is that Trump ordered this. What is it called? The national health crisis, right?
Yeah. Public health emergency.
Public health emergency. That's what it's called. Public health emergency. And so by calling it that, it's a 90-day stand with the potential to go longer. Right. It doesn't have to stay at 90 days. I can obviously go longer.
But it doesn't have to be renewed or something like that?
It does have to be renewed. So the only bit of criticism, and here's the weird thing, because we're talking about Donald Trump, the guy that can say good morning, the guy that can say have a nice day, and people would get mad and say, don't tell me what to do.
Sure.
They would have a large parade saying, Trump just told us what to do.
Sure.
Let's revolt, because he said, have a nice day. Right? It's true.
Yeah, no, of course.
So here he gets on there and he says, all right, it's a national what's a what?
A public health emergency.
I can't get the wording right. A public health emergency. And people said, well, why didn't he just call it the state of emergency?
Not a national emergency.
A national emergency, which would make more funding.
Mm-hmm. Correct.
All right. So here's the thing. First of all, I got a feeling this guy can create funding no matter what he calls it. I don't think the calling it anything is going to be a big deal, because I don't think this is going to end in 90 days. There's nothing in what he said that said this is going to end in 90 days.
No.
Because he said this could take a decade. I mean, he even said that within his speech. He said this could take a generation. This could take a decade. It could take a generation. But we will be the generation to end this opioid epidemic.
So he could be, yeah.
Yeah.
That's his goal.
Well, he said he will. I think didn't he?
I think he said could be, but who knows? I mean,
well, we can just quote him. We're allowed.
The only thing with him is just there's so much hyperbole you got to kind of get through to get.
And other politicians never did. God, that popping is driving me nuts. I'm gonna need to get my pop screen. But and other politicians don't. Is that what you're saying?
Come on, not quite. He's not known as the best orator. Is all I'm saying. Like when you go from somebody who like Obama, who it can put you to sleep with like the sweet lullabies of the way he talks.
Well, you're in love with him.
And I am. And then I just he was a good orator. I mean, I love his speeches. But
that's a very dangerous sentence to say. Don't say that sentence again, especially now that you have low testosterone.
Sure.
Don't say that Obama's a great orator, because it just.
But when you go from that to Trump, who is bigly and stuff, it's difficult sometimes to get through. But it is what it is. Right. I like what he said. Bottom line, though.
Yeah.
You're just talking about how he says like the largest, greatest, most significant campaign.
I agree.
Yeah, that would be the hyperbole as I'm talking about.
Right. Is that what hyperbole means?
Yeah.
Exaggeration.
When you stick in extremes and
Why did you just say exaggeration? Why didn't you use hyperbole?
You know what I was talking about.
Yeah. Well, yeah, but he's at Rollins College and he takes like.
There you go. Organic chemistry.
You can't even say organic.
Exactly.
But anyway, yeah, I get what you're saying. He does always say it's the biggest, the greatest, like the world's never seen before.
Yeah, right. And we're going to end this ourselves. We're going to do all these.
But you know what? That doesn't bother me, though. I go for it.
Yeah, it doesn't bother me. You just got to sift through that.
That is truly the American way, by the way.
Sure. You just got to sift through it to get to the point.
Yeah. That the American way is to say we're the biggest, baddest, toughest. That's typical America. I mean, he's a product of his environment, right? He's a product of America. But anyway, so yeah. So what was it about that you liked? First, just by saying that, are you cool with that? The fact that do you feel confident that by calling it, no matter what he calls it, that they're still going to stand by it? First of all, let's get with that.
Yeah, I think the nomenclature isn't really a huge deal. I think the fact that
you
this
guys with these words. Jesus.
Would you say that's part of his lexicon?
Yeah.
Nomenclature.
I think the fact that this is out there as an actual legitimate public health.
Right.
Yeah.
The fact that they're talking about it.
Exactly.
Well, I like the fact that they're talking about it, number one. Obviously. Number two, I like how in-depth he got with things, and I'm sure we're going to continue to address this.
Right.
And the other thing I liked about it, though, is kind of put his money where his mouth is.
Right.
He mentioned it a while back. He didn't quite do it, and a lot of people were upset.
2 months ago.
A lot of people thought it was never going to happen. And for whatever reason, maybe he had more planning to do, or who knows.
Right.
It took, as Robbie just pointed out, 2 months.
Right.
But it came out. And so, to me, I like, if you're going to say you're going to do something, do it.
I don't mind the waiting. I got to say, I don't mind the waiting.
Yeah, the waiting, I don't know why they waited, so I can't say I have a problem with it either.
I think it's, I don't know, I kind of feel like it's kind of obvious. I mean, once you see the entire list.
Yeah, it's a big problem, man.
Yeah, once you see the entire list.
Yeah.
So I'm going to take the first thing that you said about the hyperbole. Being an individual that pops off at the mouth, says whatever he's thinking at the moment.
Sure.
Tweets, or maybe not says whatever he's thinking at the moment, but he definitely tweets it.
Oh, yes.
Right? And so, but I think the things that he does like that, I think it's because he knows that he makes the news. He knows that no matter what he tweets or says, becomes the top story throughout every news venue. Right. So it's his way to control all the media. His way to control what gets said is, I'm going to say this, whether you like it or not, and that way you at least have to talk about it, right? All right, so
you give him a lot of credit, but yeah.
Well, no, because in one thing, I do think manipulation is a strong thing that he has, and that is a manipulation tactic. That's a control issue, and he knows how to manipulate the situation to get what he wants. I mean, he knows how to get ratings.
Right.
That's no doubt. He did have a high-rated show. He does know how to get attention. He was an attention getter. He was famous from just being a developer, brother. You know how many developers we have, and how many of those are famous? How many of those can you name?
Because he made sure his name was in big gold letters everywhere.
But there's even people with big names everywhere on buildings and still not that famous.
Yeah.
He was a Hollywood star when he was just, very young, just by being who he is. So in other words, what I'm saying is he knows how to get attention.
Yes.
All right. So with this, by waiting, it kind of shows me that he may have popped off at the mouth, but before he actually has some plans in place or some other things in place, that's all he's going to give you. He'll say it's coming, but he's not going to declare it until he's ready to move forward with it. And I think now they're a little bit more ready to move forward with it.
I think another thing to mention about that is when he first mentioned it 2 months ago, we hadn't really seen a lot of this opioid crisis stuff in the news, and ever since that 2 months ago, it's almost been a daily thing where it's just been brought to the forefront.
Right. I think he was fact-finding.
Yeah.
I mean, think about it. As a natural, normal citizen, how many average-day citizens, no matter how smart they are or how invested they are in business, how many of them know the numbers and the drastic numbers that are the truth? So I'm sure before he went on the air and made it so huge, he had to know, is it really as big as I'm hearing, or is it hype?
Yeah.
Because if anybody knows hype, it's a hype man, right?
Yeah.
So he has to make sure, maybe by you saying it's the biggest problem ever, is like him saying, well, how many times a day I say it's the biggest ever. Mm-hmm. You know what I mean?
So it really is this time. Yeah.
And I think that's the difference. I think as he did his evaluation and he did his due diligence, I think his team, not just him, his team kept bringing him numbers. And every time he traveled and went into another state, another area, and he kept hearing the exact same thing, he all of a sudden realized this is exactly as big as I keep hearing. So we're going to have to do something about it. So I don't really care about what they call it, because he's talking about it. And like I said, anything he talks about gets news. Now, here's the thing I am disappointed in, though. Now, he did talk about it, right? And said it?
Yep.
Correct.
Yet, I can flip channels and I'm still hearing about Russia more. I'm hearing about Russia and Kennedy more than anything. It's almost like this Kennedy thing took too much attention off of the opioid crisis.
The paperwork or the files.
Yeah, that bothers me a little bit. That bothers me that so many news channels are spending more time talking about the missing Kennedy data and how come he didn't release it all.
Yeah.
Who is he protecting and why did he release it? You know what I mean? Instead of just saying, this guy did a phenomenal thing on this opioid crisis, how is it going to look? Let's dissect it, because there's like 20 points he mentioned let's dissect it. You could do how many hours of programming just on dissecting that speech, right? Sure. So that bothers me a little bit. The narrative continues to go back to politics. They go, oh yeah, he did really great, but now let's talk about this Russia connection a little bit more. Blah, 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 blah. Yeah. So the right is still talking about Hillary and the DNC and the Russia connections, and the left is still talking about how, impeach. Did they just forget we just had this good talk about opioid crisis?
Yeah.
Well, once again, nobody wants to talk about that.
But doesn't that? I thought today would be a different day. I really did. But all throughout all the news channels,
nope,
it's the same thing. They'll mention it. In Fox 35, God bless them, here locally, they mentioned it, but everybody's talking about Kennedy.
Yeah.
But anyway, all right. So what are the points, Trinity? Let's start going down the points, Trinity and Robbie. Which one of you want to go first?
Yeah, I'll go first. Okay. So, new policy to overcome a restrictive rule that prevents states from providing care at certain facilities with more than 16 beds for those suffering from addiction.
Okay, what does that really mean? So the person that's watching it, whether they're watching on Facebook Live or whether they're listening on the radio at WPSN99.com or whether they're watching the YouTube show, what does that mean, Robbie?
All right. So since 1970, there's been this rule that certain facilities with more than 16 beds can't offer up so many to those suffering from addiction, and it's been, you can probably word it a lot better than me.
No, I think you're doing great. Here's the bottom line is it's ridiculous that there's a cap in the first place.
Right.
Right.
And this has been in place for 40 years.
Right.
Yeah.
So I think and how did it take 40 years for a president to even notice that they had a cap on how many addicts can get beds at these state-funded, publicly funded facilities?
Yeah.
Yeah, I wasn't aware.
Did anybody even know about that?
I didn't know about the rule.
You know why we didn't know about it? Because nobody was complaining about it.
Yeah.
Yeah.
I mean, that's a shocker. That was the first thing he mentioned, right?
I believe so, yeah.
What do you say, 1970s?
1970s.
We haven't had a drug problem since 1970? Is that what we're saying?
Yeah.
For real?
Yeah.
I mean, we've already been in this opioid crisis, really, for a good 6-8 years already.
Yeah.
At least, yeah.
At least. So here we went, how many years of how many people dying, and nobody's done anything about it, and they didn't even look at this rule. No. This rule wasn't even changed. Nobody's screaming about that.
Nobody even talked about it.
Nobody's saying, oh my God, what was this rule and what is it?
So it's really just going to free up more beds.
Free up more beds. And then the second one he did is he said, whatever's in the way, whatever's blocking the way of someone getting help, we're going to look into that. Now, that's not very specific.
Yeah, we don't know what that means.
Which is very political anyway. That's a very politician thing to do. We're going to do it, but nothing specific. This is not new. However, I'm very interested to see what those specific barriers are that he's going to move aside.
Right.
Okay.
Well, maybe, off the top of my head, I can think of, maybe someone that's been to treatment, 6-7 times and they won't be allowed back. Maybe that could be a barrier.
Maybe. I do know a local facility that if you go into them, and I'm talking about a public facility, a publicly funded facility, that if you've used them a couple times and relapsed, that they will not have you back.
Yeah, see, that's
exactly. They make you wait. They punish you.
That's exactly what I'm saying.
No. Which is ridiculous. Can you imagine? Can anyone imagine a hospital telling your mother or father, well, listen, he's had 2 heart attacks. This third one, we're not going to take him.
Got to wait.
Yeah. We told him not to eat the high saturated fat foods, but he did it anyways.
That fat, lazy, inactive bum of a father you have needs to just, you know what? We're not going to take him.
Just sit down and wait. We'll get to you.
Man.
Wow.
So in any other health problem, that would be uproar. But no, in addiction, you can do it. All right. So Trinity, read us another one.
The next one listed here is the Presidential Commission headed by Governor Chris Christie, and the report is forthcoming soon. So basically, he put together kind of like their own 9/11 report almost, but for the addiction issue, and kind of come up with different solutions and ways of combating it, with Chris Christie heading that up, and he's expecting next week to have the results.
Right.
He says he's already gotten some of the results, but he wants the whole thing next week.
Thing. All right. Now, any thoughts on the significance of that?
Well, I just know that Chris Christie up there in New Jersey, they've come up with some pretty interesting things. We've read about a few of them on the show.
Mm-hmm.
So I don't know much about Chris Christie other than the things that you hear hyped up during the campaign, like the whole the bridge thing and
right.
The shooting of the JFK or something like that. I don't know.
You're talking about the negative stuff.
Yeah,
what channels do you watch and listen to?
I flip
all
through,
the negative.
My point being is I haven't heard much about him, being the fact that we're not up in New Jersey. So I don't know.
Did you hear about him getting mad at somebody at a baseball game too, or something like that?
No.
Yeah, he did.
My point being though is I have no reason to believe that he's not competent. And he's not a
Right.
good guy for the job, basically.
Yeah.
And the things that I have heard that he has done have been good as far as addiction's concerned.
Yeah,
So I think it's a pretty decent person to have heading it up, is what I'm getting at.
I would agree to that. I think I'm a little ignorant to the workings of Christie in New Jersey, I got to admit. However,
Yeah.
when it comes, I agree with you that when it comes to this subject matter, I've only heard positive things
Yeah.
about on this subject now. So if you're not a Governor Christie fan, and for other reasons, for one of those things that Trinity mentioned or others that we don't know about, that's fine. Again, politics aside, when it comes to our issue,
Yes.
you know, we don't pick politics here. We go with whoever is talking about addiction and recovery and trying to help people get better. That's all we care about. And at least on this subject, he did look rather genuine when he talks about it. He does come off, and maybe he comes off like that all the time. I don't know if you guys may
like I
know
said,
better, but he comes off real genuine when he talks about this problem.
I mean, I think we know more if we were in New Jersey. We'd see more, obviously. But the addiction issue, he seems pretty, on the forefront of that.
Well, I've heard some of the commercials coming out of there, and he's actually on the radio and on television saying, "Call this number." Like they have like a national, a state line that they want people to call and get up. So I'm very impressed with that.
Yeah.
Well, plus I know he's reached out to like other states that are being successful in certain things. He's reached out to them. I think he reached out to like Ohio when they were doing some of the stuff that they were doing to figure out, what was working, what wasn't working.
Okay, Robbie, what's another one?
Another one is the federal government is aggressively fighting this problem on all fronts. I think that's kind of like what we've been talking about. And then it goes on to explain that physicians are going to have better practices for safe opioid prescribing.
Oh, yeah. Let's talk about that a little bit. Okay, so what are you guys thinking about that? Physicians are gonna get additional training. Like the FDA, the FDA is going to force them to get additional training.
Well, two things pop in my head. The first thing that pops in my head is, as the layman.
Like, where were you?
Well, the first thing that pops in my head as a layman is like, oh, that's great. That's a good first step. I like that.
Right.
However, the more skeptical side of me that knows the inner working sometimes of continuing education when it comes to doctors, my concern is, what does that look like?
Right.
Is that like an optional 1 hour video now that they're going to have to watch? Or is that like an in-depth kind of like, hey, this is what we're doing here?
Right.
I would be curious to see what that looks like.
Yeah.
Okay.
I would think it's like maybe like a couple hour course, like specifically about opioids, because, they have. I would think that medical schools already go through this kind of like the dangers of opioids and how to prescribe them, but I guess that will just be intensified.
Well, here's what comes into my head. What comes into my head is somehow, the FDA gets all this money to oversee these things, and rather than coming out and saying, look, the FDA is just allowed this to happen for way too long. I think they should have stepped in a long time ago, and so I'm dismantling the FDA. Right? Instead of coming out and saying something so ridiculous like that, he's supporting the FDA and saying, look, we're going to ask the FDA to do this. The FDA is now going to make it mandatory that people get additional training. What that tells me is that he may not be fully aware of all the trainings that they already do have, or how that even looks.
Well, there's a couple of layers to this, though, because I'm looking at a few of them here, because I did watch a speech, and I don't remember all of the points, and so I'm trying to look at the list here.
Right.
So it says here the federal government is working with medical professionals to implement best practices for safe opioid prescribing.
Right.
That seems like one aspect of it. But then it says requiring federally employed prescribers to receive special training.
Right.
So it seems like the special training is going to only be for federally employed like doctors.
No, that's an additional thing. So all right, so you have the FDA forcing that the pharmaceutical companies, when they send their rep out to a doctor's office, they're forcing them to give them more information. Here's all this language. You know what all this is all about? Liability.
Sure.
This is a businessman looking at it from a litigious eyeball. He's just looking at it from saying, all right, right now we're liable. Right now, pharmaceutical companies are liable. If you don't want to be liable, if you don't want to get sued by us or by somebody else, then you better do as many trainings as possible to teach the physicians that you're letting prescribe your medication. And then on our end, that's why this is what we're going to do, because that's like their hospital or their clinic. We're going to make sure our doctors are all trained specifically on how to effectively prescribe medication to pain management people, because they're going to investigate pain management a great deal.
Sure. Oh, yeah.
Which also leads us into another point we'll get to in a second.
Yeah.
But the whole pain management deal, right? And so I think what he's doing is he's leading by example. He's saying, we're going to retrain ours.
Right.
We're going to have FDA force you to retrain yours. And pharmaceutical companies, you're in charge of that. You have to go do that. So now it's like multiple layers of everybody doing training. Now the training is because doctors tend to use language like habit forming.
Yeah.
So what I would have liked to have seen, what I would have added to that, and he just may not be aware. Again, remember, this is a business person that we've asked to be a politician. So now this is a business person that we've now asked to be a health crisis manager. And I think what I would have liked to have seen is maybe him say, we got to get rid of this outdated, manipulative language of habit forming. We have to, just like the cigarettes say, this may cause death. Medication, certain medication needs to read just like that. Not just may cause drowsiness, may cause death.
Yeah.
Right? There has to be a little bit stronger warning label on the medication, or there has to be a stronger warning verbally given by the physician. And I think what you're going to see is exactly that. I think we're going to see,
That's what I want to see.
changes on labels, because they always go to that's how pharmaceutical companies get that's the oversight on is what they put on the label.
Sure.
Right?
See, I want to see
that's
more.
the liability on that.
I want to see more the doctors get into it,
Well,
not
for
the labeling.
What the sad thing is, I've heard a lot of physicians being able to blame the pharmaceutical companies because we have at least one pharmaceutical company that is now known to have lied about the dangers of that particular medication. So now we see a lot of doctors go, well, they told me, so I just did what I was told. They're going to play that card. No, we're going to hold you responsible too. It's your job to you're that middleman. You're the drug dealer, right? Or you're the healer. You can be one or the other. Either you're going to be a healer or you're going to be a dealer, but you're going to be one or the other, and you have the power of that pen and the power of that prescription pad.
Yeah.
So I like the fact that they're going to require additional training, and I like what you said, Trinity, because yes, I know about those CEUs too, or CMEs when it comes to physicians.
Yeah.
And let me tell you something. A lot of them, you can just sleep in the back of the room.
And you still get credit for it.
And still get credit for being there. You go to a conference in Las Vegas or something like that, and you're not really paying it. Jeez, that popping's going to drive me nuts. You really don't have to pay attention.
Yeah, so that's my skeptical side, of course. It's just
Right.
like I'm curious as to what it looks like. But the thing that it seems like we took two different things away from his statements about that, about the training and whatnot.
Right.
Is I really do sincerely hope, and I'm saying this from personal experience. I know somebody who's prescribed opiates.
Right.
There wasn't really a whole lot of follow up as far as hey, are you struggling with this, or there was no protocol in place to make sure that the individual is not struggling with addiction somehow, some way. It wasn't really done very well.
Correct.
So I'd like to see that done better.
Yeah, I agree with that. I think there needs to be a lot more conversation in regards to how dangerous it was, which is why today, Robbie, you asked, what we were talking about on Fox 35 today, this morning on the morning news on Good Day Orlando, was just that. One of the points was, what is an opiate? What does it look like? And how do I know if I have one in my home?
Yeah.
You and Trinity both made the same face that I initially made when I heard that, and I was thinking, wow. But remember, Trinity, when we were talking about how people look at addicts and everything like that, you were like, you just don't know because you're not, you've been in it so long, you just, your world is different. Well, guess what? Look, when I said that to you guys, our world is so different. Yeah. They were like, what? How do you not know what an opioid is? Mm-hmm. But there's a lot of people out there. Unfortunately, there's a lot of people right there that are prescribed opiates, or their parents are, their grandparents are. Mm-hmm. And they're going to be shocked when they go check out their medication and Google it. Just Google it. Google the medication. But if it says that it may cause drowsiness, then, or if they had some sort of procedure, some sort of surgery, whether it be dental, no matter how minor that procedure was, even if it was an outpatient surgical procedure, the physician, if they use words like, this is going to help you with some of the discomfort, this is going to help you with some of the pain, then more than likely you have a narcotic in your house. More than likely you have an opioid in your house. And that's what Take Back Day is about. So remind me, Robbie, to not forget Take Back Day, in this conversation today. But that's, so most of those are opioids.
Yeah. Well, and just while you were talking, I was looking up something that I posted the other day as a comment on somebody's page, just as an indicator. And that's why on a side note, why I'm so thankful that Trump kind of said what he said is because I do think a lot of people don't understand the role that doctors are playing in this thing. And an example, I'll read some of the guy's. I won't say his name, but I'll read a comment that was made.
Okay.
It's a long comment, so I'm gonna do my best to summarize some of it.
Oh boy.
It just said basically, if drugs were legalized and provided by doctor prescription, the strength and purity of the drug would be controlled. Most drug crimes would be eliminated, the drug cartels would be broken, and the government would profit from the taxes gained from sales. If people want drugs, they're going to get them one way or another. I don't know a single person who wants a drug who can't get it. Certain designer drugs like meth are more problematic, both in general. We save the billions spent on DEA and other enforcement agencies and blah, 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 blah. So, but his first thing there was drugs are provided by doctors. They are. Like, that's where the opioid crisis is coming from.
I think that's where he lost me in the first sentence because the ignorance began right in the first sentence, acting as if this has not been talked about. Look, first of all, let me take a second here. Alcohol was a medication that became like socialized, but it has medicinal purposes, and you can find alcohol in many different medications. Heroin, same deal.
Yeah.
Medication that then made its way, into street and medicinal purposes.
Heroin was actually first, if anyone doesn't know, it was actually first released by whatever pharmaceutical company, Bayer Pharmaceuticals, and they released it as an alternative to morphine addiction.
There you go. There you go.
So it was a safer alternative.
It actually was a medication.
Yep.
So
over the counter, nonetheless.
There you go. Cocaine used medicinally and non-medicinally. These are all amphetamines. We use them for ADHD kids all the time. You know how many doctors are prescribing amphetamines to ADHD kids?
Even methamphetamine is a federally controlled prescribed drug.
There you go. So every drug that you probably, even MDMA was used in some circles and stuff like that. Acid was tried to be used in some circles. Listen, so this is nothing. And by the way, for all the people on marijuana deal and want to argue that, Marinol has been on the market for a very long time. I don't see any of you asking your physicians for Marinol. You want to smoke it. You don't want the medicinal THC because it's been available as Marinol forever. So the point is that most all drugs are being controlled by physicians and prescribed by physicians.
And that was
and have street value.
My response to that comment was something along those lines. I was like, well, technically, I see more people who started with prescriptions from their doctors than somebody on the street corner. So the idea that putting in doctor's hands it'll all be okay.
No.
Not so fast.
I think the latest numbers were like 70% of all heroin users got there by misusing pain prescription medication. Yeah. That's a huge number. They didn't get to heroin from pot, alcohol, cocaine, or anything like that. They got to heroin.
Not the gateway?
Well, neither, but nothing was the gateway to heroin right now. The real gateway to heroin right now truly is
doctor prescription.
Doctors prescribed medication.
Real quick, we have a couple comments on Facebook. I want to address them real fast.
Okay.
Cromie Lloyd, which I think that's Tommy.
That's Tommy. How you doing, Tommy? I owe him a call back, by the way. Tommy, I'm not ignoring. I'll call you back. I will. I've been out of town.
He said the field of addiction psychiatry needs additional updated training as well, not just pain management. And then
psychiatrists need to learn how to do a shot again. I think most psychiatrists don't even know how to give a Vivitrol shot anymore. So they've been so out of the loop. They've been used to just doing like therapeutic type talking or just prescribing that they don't even know how to give a shot. Mm-hmm. How many psychiatrists do you know do injections?
I don't know any, actually.
Here's some Klonopin. That should help.
There you go. And that's why they lose respect. That's why psychiatrists don't get the respect they just. Whoa, what is that?
Oh, somebody's phone's going off.
That's probably a doctor. I'm sorry.
And then,
did I upset you?
Psychiatrist.
Psychiatrist. And then Kathy Phillips, which mother. Hi, Mom. Thanks for watching. All right. She said they label sleeping medicine as habit forming. Why not meds for pain?
There you go. So, and I hate the word habit forming.
Yeah.
It's so benign.
It sounds so like non-disease.
Well, I got a habit of taking my shoes off before I go to bed. Doesn't mean I'm addicted to it.
Well, it's not taking into account the psychological issues that you may already have prior to taking them. It doesn't take into account the environmental factors that help cause addiction to be there in the first place. Yeah. It doesn't help take into account the genetic factors that help cause addiction in the first place.
Yeah,
so it doesn't matter whether it's a pattern of behavior or not. When you have genetic factors, you have environmental factors, you're in danger.
Mm-hmm. Yeah.
So, go ahead. Any other things? So, thank you for that, Tommy.
Yeah. No. It just my biggest thing was just I just listening to some of these training aspects and things. Right. I like the fact that he was taking the perspective of, hey, the doctors need to play a role in this.
Yeah, he didn't
like that.
He didn't let him off the hook.
Exactly.
He didn't let and look, and then he threatened the pharmaceutical companies and doctors when he said, "Go to the litigious thing." What was the litigious statement? The lawsuits. How did he word that?
I know it was towards the
end. It's going to be big lawsuits. Yeah, it's towards the end. They got a lot of some major lawsuits are coming. He says to anybody that hurts our people or something like that, right?
Yeah, I'm trying to. I don't know if you typed that one up.
Yeah, it's towards the end. Yeah, it is. You want me to look for it?
Sure, why not? In the meantime, though, while we're looking for that one, I know the next one he has put up was taking one of the ones off of the market, like one of the really dangerous ones, which he was very
Yeah, why didn't he say the name?
I'm assuming he's talking about fentanyl.
No, I think I don't know. It's Opana.
No, it's Opana.
Opana? Okay.
Yeah, but I had to find out from someone else.
I didn't know. I had no clue what he was talking about.
We talked about this on the show like 3 months ago, I think. Right. It was recalled by the FDA, and then I guess it still hasn't been taken off the market if it's being talked about.
He said effective immediately now. So I don't know. Has anybody? I would like to know if anyone has gotten Opana in a while. So he said Justice Department will aggressively search out, which that's always scary. That's what got me out of the drug business. That's what got me out of the drug business back in 1989 or whatever.
Cool, we're coming for you.
Yeah. That's how Reagan got me, by the way. Justice Department will aggressively search out and file major lawsuits against people and companies involved in hurting our citizens. Yeah. He said our people, but I changed it to our citizens. But so that's pretty bold, right?
But what does that mean, though?
But again, that's a business person. Again, I don't think I've ever heard a politician say we're going to go sue people.
No, never.
Again, this is a politician. This is what we wanted. We wanted someone to cowboy up and take care of some of the problems that we. Look, I'm not saying he's right or wrong. I'm just saying making that face.
But we didn't want that. I never wanted a businessman.
If he's voted in, it's a we.
Touche.
Get into it. That's the American way.
Just saying.
I said we when it was Obama in office too, man. I backed him up too.
I've never liked the idea of a business person running the country, but
I did 100%. I voted for Ross Perot. I do admit I didn't vote for this guy, but I'll support him. Right. But the point is that I always support whoever's in office because I do believe in the system. So the we factor is that we wanted somebody to cowboy up and shake some of these companies up, right? Mm-hmm. So he's saying we're going to aggressively search you out if you're hurting the end person, our citizens, by lying to them, by giving them, medications or drugs or whatever that's going to get them addicted and die. We're going to aggressively come after you. So I like that he didn't just take the focus on China or Mexico, because remember, everybody freaked out, and including me, when I first heard the Mexico thing as a Mexican, I first freaked out until I listened to the whole body of who he was being and how he was presenting the whole deal. Then I completely backed off and I did a 180 and said, look, he's not talking about Mexicans. He's talking about those Mexicans. You know what I mean? And so there's a difference. It's like when you talk about, it's like when you say those people and some people get offended and go, what do you mean by those?
Right.
It's like, we can get oversensitive. Okay, so in other words, I like that he's just not talking about China. He's not just talking about Mexico. He's also talking about here in our own place. He's saying, you here, doctors here, pharmaceutical companies here, we're going to aggressively search you out and do something about it. And then he also included China. We're going to come and have a discussion, and there will be some changes. You're going to need to continue doing what you're doing. Thank you for getting that one guy. Like one guy's the whole fentanyl issue, but it was a symbol. It's a symbol of what's to come, and we know the Asian countries do there's a lot of things with symbols, and there's a lot of symbolic things with them. So, like if one person gets treated very harshly a certain way, that's their whole methodology. At least that's what we learned from it, right? Anyway, so then you have, and it also supports this border thing. Which, by the way, I can't believe that I'm actually saying build your damn wall. I don't care about the wall anymore. I know. Look, I know. Despite what he says, that it's about it's not about you're not going to stop drugs. You know how many drugs you stop by the wall?
None.
You stop a couple kilos.
Yeah.
I mean, how many guys you have to have running with kilos to be significant to bring drugs over? Our drugs are coming over in trains, planes, and automobiles, brother.
The submarines.
Absolutely, they're coming. when let me tell you something. When drugs are brought into this country, they come in mass. They come in tonnage. Yeah. They don't come in one person at a time. You know who brought drugs in this country one person at a time? In like 5 or 10 kilo bundles? People just like me, people. That wasn't significant. 5 or 10 kilos coming over one person is not the tonnage that we have to stop. And that's the real deal. And that's coming through our actual doorways in our border. So build a wall because we have a fence there anyway. And that's the other thing that we never talk about. It's like at your house. Like at my house, my dog has destroyed one of my fences. Just destroyed it. It's pushed it down to the point. And it's not my fence. That's why I haven't fixed it. It's my neighbor's fence. But he's completely destroyed it and keeps going over the fence. We need a wall. Now, if I say I need to build a wall, or if they would tell me we're going to need to build a wall because of your dog, I'm not going to go, what, you're going to build a wall because I'm Mexican? You don't want my dog over? No, they're going to build a wall because they're tired of my dog coming into their damn yard and scaring the hell out of their kids.
Sure.
That just makes sense.
Yeah.
It doesn't bother me whatsoever. We all use barriers. This is not to keep legal stuff out. Anyway, it's not going to stop heroin. I'm sorry, Trump. It's not going to stop the heroin from coming in. However, it's symbolic, and I think again we use a lot of symbolism. So with the Chinese being active with us and being in partnership with us, it's symbolism on two fronts. One, it shows that we're working together because this is a global issue. He did say this is a world crisis. This is not just an American crisis, even though we're suffering the most. This is a world crisis, and we need all of our world partners to be involved in this. And he's using China a little bit on this because he's also talking to the little man up there in North Korea a little bit. You know, saying, you know what I mean? It's like we can have another discussion on the side about this North Korea guy while we're sitting here talking about drugs. I'm sure that's going to happen. But also talking to Mexico and getting that solidified and saying, look, this is why we're doing it. Mm-hmm. You know, so whatever it takes. I don't care. It's a negotiating tactic.
I think another point that goes hand in hand with that is the inspection of packages that are coming into the country.
Love that.
Yeah.
Love that.
And I mean, what you're saying about kilos, like traditionally when we think about like a kilo of heroin, like sure, that's
right.
like a drop in the puddle. But when you're talking about a kilo of fentanyl, the lethal dose of fentanyl.
That's a big one.
Great point.
Yeah.
And a kilo of crystal meth is also a lot.
Yeah.
So great point. The fentanyl,
that's enough to kill
that's
a
a ton.
lot of hardcore
That's like
addicts.
a ton. Yeah. It's like a ton. Yeah, so you're right about that. I misspoke when I was thinking about fentanyl.
But that is one big thing that's coming in packages, and
that
I guess
coming in packages.
The drug dogs aren't really able to detect it as well as other things. So
correct, and I like that he didn't just say we're going to investigate. He says we have to learn how to do this. We have to research new methods.
Yeah.
He kept saying things like that. We want evidence-based practices. We want things that actually have been proven to work. We need to learn more about it.
Yeah.
That's kind of that's honest. That's real honest.
Sure. Well, that brings us to the next one, which the one that it really cut my ears, only because it was a little bit of hyperbole, but I liked it.
Here we go with that.
Well, I liked it actually because it seems like he's trying to do something that nobody else has really been talking about that I've heard anyways in the mainstream.
What do you say?
And he says the National Institute of Health will work with pharmaceutical companies to develop non-addictive painkillers and new treatments for addictions and overdose.
Listen.
I like that.
Wow.
Like that, it's very
big promise.
Yeah, it's very
That's
it's
a
big
huge promise.
It's a very big lofty goal.
Yeah.
But why not? Why not look into it? Like we're supposed to be the country of innovation. Right. We stopped innovating years ago.
Right.
Why not?
No.
Maybe you fail. Who knows? But you'll get a lot closer if you look into it. You never know what you find.
Let me tell you, that is as significant as the president saying we're going to land on the moon.
Yeah, I loved it.
That is a huge statement, and I think you're right, Trini. I'm glad that you picked up on it to be so major because that should have been like front page.
Yeah, it was huge.
That's a headline right there.
Nobody's ever done it. We've had the same pain medication since the beginning of man almost, and nobody's ever said, "Hey, maybe there's a better way."
Yeah, and let me tell you something. When a federal government says we, what they're saying is tax breaks and money, brother.
Yeah.
The unseen tax breaks, the unseen money that you're being offered. That's why that's why I don't mind it not being called a national emergency. Because I think the money is going to be given in so many different ways. When he's saying, I'm already allocating money for border agents. I'm already allocating money it's already in my budget in different ways. We're not using it right.
Yeah. But these grants that go to the universities that have the greatest organic chemists in the world that are discovering these drugs.
Can you imagine?
That's promise.
It's going to be, it could be you, Robbie.
I don't know about that, but...
Well, why not?
Yeah, why not?
Why not? I mean, Robbie, it actually can be you. In a few years, you could be at a university studying the greatest, newest medication, and wondering, oh man, this is probably I'm just doing this for class.
Right.
So sorry, Louis and Trinity, I won't be there today because I'm working on this
Exactly.
this medication.
Yeah.
Medication X, and medication X could end up being it.
Yeah.
It's funny that now we're talking about it. I looked up non-addictive painkillers, and there's so many questions being asked, like on the most popular searches: is tramadol a narcotic or not? That goes back to what we're talking about.
It just got read on that. It just got classified.
Well, there's something else.
Reclassified not too long ago, last year.
Yeah, there's something else though. It says non-addictive painkiller being developed at IU shows promise. So like these things that are actually being developed are being brought to attention now.
Right.
And that's what I liked is
Absolutely.
nobody's talking about that. Like I haven't heard about that IU. Why was that not plastered everywhere? Why is nobody saying, hey, look, guys, here's an alternative?
Right.
Because you can find a good alternative that can take away the pain that's not addictive.
Right.
Hello.
And added to that, you know what accompanies that is another thing he said about investigating the alternative treatments for pain.
Yeah.
Well, every acupuncturist and every chiropractor,
their ears perked up on that one.
Loved that statement by the president.
Oh yeah.
Because what yoga person, what chiropractor, what acupuncturist, what natural holistic physician ever got any praise by anyone in government saying, listen, I'm going to bypass your medical partners over here that seem to disrespect you a lot. Let's talk to you, dietitians and people that know nutrition. Let's talk to you, people that know physical exercise, Trinity Phillips.
Sure.
Let's talk to you, people that know chiropractic. Let's talk to you, people that do massage therapy. Talk to me about how these practices help. And you know where that came from? I guarantee you that came from when he's investigating the treatments that do exist and realizes all the best treatment centers use all that stuff.
Yeah.
All the best treatment centers, substance abuse treatment centers, use acupuncture. Use the auricular therapy specifically for acupuncture. Use yoga. Use massage therapy. Use all these additional stuff. Exercise.
It works.
Correct food. It works. But the problem is that the medical community doesn't ever know anything about nutrition. I'm sorry, docs. Here I go again. I'm really going to anger the doctors now. But you know the training in nutrition is that's not where you spent your time. And you physicians out there, you know how you look at people that talk about holistic medicine. You know how you look at chiropractors, and you know how you look at massage therapists, and you know how as a community, I don't mean you specifically, but as a community, you know how the medical community disrespects acupuncturists, massage therapists, chiropractors, nutritionists, exercise, physical therapists, master trainers. I mean, seriously, let's be real here. So, I mean, you guys even disrespect psychiatrists. We talked about that earlier, just because they don't know how to do shots, and you don't even consider them real doctors sometimes. So, this needs to be done. And so, for a president, the highest, the most powerful person in the world to say, we're going to investigate more ways to deal with pain management. You know why? Because you guys failed. Because you failed to treat pain correctly.
Yeah.
Not only did you fail to treat pain correctly, but then you allowed some of your colleagues to mismanage their pain clinics and turn them into pill mills. And we already went through that madness. This is all a baby born from the pill mills. That's where this came from.
Yeah. And so moving along to the next one, which I personally liked.
We're obviously running out of time.
The one I liked as well was, let me see the exact wording.
Okay.
A massive advertising campaign to prevent children from drug use by teaching them what it really does.
Major.
I like that one as well.
Major.
I'm all about the prevention stuff myself.
Right.
And so I like the fact that I've already heard some people complain that he was saying, don't do it, and kind of like the dare say no to thing.
Oh, because it sounded like
but that's not how I took it, though.
Right.
I didn't take it him saying, somebody who's already struggling with addiction, just tell them to put it down.
Right.
I heard him saying to start with the kids before they start using it to let them know what it really does.
Right.
And it reminds me of that Truth campaign.
Right.
When they show the people with the cigarettes and everything. Like, I can imagine like an 8, 9, 10-year-old person seeing that and seeing the reality of it.
Right.
I could see that sticking in your head.
That actually worked.
No, I'm good. I'm not going to do that.
Yeah, that actually worked. That campaign is probably one of the most successful campaigns of all time. However, here's the problem with that campaign. Not the campaign. It's just that nicotine companies found a way around it with vape.
Yeah.
Yeah.
They had a slam dunk with truth. They had a slam dunk with truth.
Yeah.
And then vaping came.
Right.
And just circumvented the entire thing. Yeah.
But my point is, that's what I think of. is when he said the really does, and trying
Right.
to educate them and showing it's not just your friend,
Right.
getting high on weeds and laughing and saying this is fun.
Right.
They're showing them this is what could have happened to you as well.
Yeah, and how vulnerable. And this is where you got a lot of. This is you got to, for the first time. This is to the left, and as a center.
I think it's center.
I say right and I say to the left. Okay, so for the left, I got to applaud you on this one because you guys are actually giving credit to this guy on the right over here. I don't even know if he's really right, but you left are giving him some support on that, saying that you liked his vulnerability and his self-disclosure because he self-disclosed. He publicly spoke about his brother. Who died, who was an alcoholic
at 43.
Yeah, and that put him in a vulnerable position, and that put him honest, and that shows you that he did have a dog in this fight, and he didn't. And this is one time where you didn't hear that hyperbole, did you, Trinity? You didn't say, "I am so smart, I didn't drink."
No, he basically gave his brother the credit.
Right, and he didn't say my brother was so dumb he kept drinking.
No,
he didn't call him dumb and an idiot. He didn't stigmatize his brother, and he didn't pump his own self up. Pat himself on the back. He simply gave us the facts. The facts are, I love my brother. He was a great guy. To call him a great guy, even though he was an alcoholic, shows us that he understands the stigma attached to this.
Yeah.
And doesn't and doesn't blame the addict. I thought that was very telling, by the way.
Yeah.
When he says he was a great guy, great looking guy, great person, much smarter than me, whatever he said. But the point is that he is able to differentiate the addict from. The disease from the person. I thought that was.
I think
really
Melanie
good.
did too in her speech.
Yeah,
I think she made a comment about the stigma.
And I'm glad that for the first time we're seeing her step up and say, let's take something on, and that it was something like this. I love that it was this subject.
Sure.
Obviously, a little biased, right?
This is like a pot of gold for us. Like,
It really was.
Yeah.
To me, it really is. To me, I that's why I was writing everything down, Robbie. I was writing everything down because I was like, all right, I want to remember so that when they start tearing it up, when I start flipping channels and hear how they're tearing it up and what they got out of it,
we can say what was promised. And
right. And you know what? They weren't tearing them up.
Yeah.
Well, I think he did a good job.
First time ever.
It's like a very multi-pronged approach.
Everybody gave him praise.
Area.
It was the best speech he ever did.
Yeah, I think so. So moving along, we only got a few more minutes. So moving along, he talked about a couple of things that they're already doing, about the $1 billion in grants and $81 million in partnerships, the task force for pain management. He did mention about the Take Back Saturday, where you can turn into prescription pills.
Right, that's for everybody. Let's remind everybody. All right, first of all, remember, this show is sponsored in part by Retreat Premier Addiction Treatment Centers and Journey Pure. These are treatment centers that help you when you want to get help. However, there's a lot of you that wonder if your home is in danger, and a lot of times that's the phone call that we get is like, what medication do I have? Is this part of Take? All right, so there's a National Take Back Day, and that's tomorrow. Tomorrow, Saturday, which is October what? When are we on?
October 28th.
October 28th. So if you're watching this in replay, then it's, it already happened. Yeah. But October 28th, it's National Take Back Day. Go to DEATakeback.com. Yep. That's DEATakeback.com and find out where between 10 a.m. and 2 p.m. you can go give them and dispose of your medication. I like that he even mentioned that.
Yeah, it was awesome. And then he mentioned pursuing integrative approaches that are proven to work, like drug courts.
Oh, that's wow! For a guy that that everybody wants to paint as like a Hitler, he comes out and says the people in prison need some help.
And that was the next one was making sure that individuals in prison can get.
Those two go together.
Yeah.
So you got using proven evidence-based practices to treat people in the drug court system. Thankfully, we have a president that's supporting the drug court system, because you guys may think this was, and this started during the Obama administration. The Obama administration, I don't know if it was the federal or if it was state, but I know that big push happened within the last 6 years. Right. So in the last 6 years, we've been really moving in a great direction where federal and state and local governments have been supportive to treatment. So he's just carrying that on a little further. So that's not new, but he's carrying it on a little further. But I like that he added to it and added that we're going to dump additional monies into making sure these people in jails and prisons get treatment and help, so when they come out, they have the better chance of succeeding. He's absolutely right.
Yeah.
Reentry is important. And let me tell you something. I still travel. I was just, in Atlanta the other day. And that was being in a place where people that do come out of jails and prisons, and they still don't know anything about Vivitrol. All they know is about methadone. All they know is about Suboxone. They don't know anything about Vivitrol. So I like that the president's talking forward forward, and keep moving the ball forward. So that was fantastic.
Yeah.
So he's not just talking about arresting those that need to be arrested, because you can't arrest yourself out of this problem.
Absolutely
and that's
not.
what I like about it. He never once said we're going to arrest ourselves out of this problem. He's saying this: we have to fight the demand, and we have to fight the supply, and we have to fight the treatment, make sure that it's effective treatment, so that when we do stop the demand and we do stop the supply, he goes, don't forget that we have millions of addicts suffering right now.
Well, that's what I liked about he focused more on the demand than the supply. So many people talk about the supply like, stop the drugs and you stop the addicts. No, you won't.
That's what Reagan was more on that.
And that was actually the next couple of things he had. I'll read off the next three because they're running out of time. The next three were adopt the most common sense solution of all to prevent our citizens from becoming addicted to drugs in the first place.
Right.
Focus on drug demand reduction. Confront the culture of drug abuse head on. And we are going to overcome addiction in America.
And I think I like. It says we're going to confront this
head on.
Fronts.
Yeah, I like
we're
that as well.
Confront it head on. And he said we're going to take the fight to them. And I like that. See, I think why this guy has gotten points with me is because I kind of like aggressive people that are going for what they want. Mm-hmm. I'm not really into people that stand back and want. I'm not a big believer or fan of entitlement. I'm not a big fan of someone that sits back and doesn't make something happen.
Right.
So I don't have to agree with everything he says, but what I do like about it, that when he wants to do something, he takes the ball and runs with it. He moves forward. He does. He plays that little tough guy, and that's fine. I don't mind if you could back it up. I don't mind. It's the same reason I used to like Detroit Pistons. Dennis Rodman. A lot of people didn't like Dennis Rodman. Too flashy, crazy, all the tattoos, everything. Let me tell you, why I like Dennis Rodman? Because he talked it, but he backed it up.
Number one rebounder in the league.
Absolutely. Why I like Deion Sanders? A lot of people didn't like his prime time. Why? Because he backed it up. A lot of people. What's about? Oh my God!
Muhammad Ali.
No, Muhammad Ali, Floyd Mayweather. A lot of people don't like him. Talk too much. Back it up. 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 I don't care what you say. I don't care how much crap you talk as long as you back it up. What I hate is people that don't do anything and just judge everybody. Right. If you don't have a solution, so all you want to do is judge everybody with a solution and just sit back and go, oh, that's horrible. Oh, that's bad. But what have you got?
AKA Facebook.
Exactly. What have you got? What are you doing? What are you doing other than complaining?
Yeah.
So here's what I'm going to ask. I'm going to please stop the impeachment talk. Not because I believe in this guy politically, but just it gets us nowhere. It gets us nowhere. Stop the ridiculous talk because, he's taking us to nuclear war. This dude has been over there building nuclear weapons for a long. This is not a new issue.
He didn't just start yesterday.
He didn't. And just like Trump didn't create the addiction problem, but he's going to help resolve it. Trump didn't create the nuclear problem. He's just trying to help resolve it. He didn't create our political problem and disruption. He said he was going to go drain the swamp. You can call him a swamp all you want. But what's happening? You have Democrats and Republicans going crazy. You have politicians going crazy right now on both sides. That's exactly what he wanted to do. That's what his voters wanted. They wanted to go in there and disrupt the whole scene. All we care about on this show is addiction and recovery. Make sure you that are listening, that you want help. Look, get all that other stuff out of your head. What's important is that if you know somebody that's suffering from addiction or suffering from a problem, there is a solution. There is recovery. And it sounds like we're going to get some backup. It sounds like we're going to get some help. Now, there's a lot of details missing in all this. In this stuff. Don't get me wrong. I mean, I didn't hear exact specifics on certain things, but I don't think it was the format or the place to get into those real specifics.
Right.
I think there's a lot yet to come.
Well, it seems like they're waiting on some of those specifics to come out of that report that Christie's going to give too, though. So
I think a lot's going to be put on Christie. A lot's going to be put on Christie, and that's good. I think we'll hear a lot more, and we'll see where it takes us. Robbie, final comments, final thoughts.
I think it's a step in the right direction. Something that we've all been waiting for. Yeah.
You happy with what you heard?
Yeah, definitely happy with it.
Right. Very cool. Anything else? Anything going on that we need to? Any birthdays or anything you want to mention and talk about?
I don't have any birthdays coming up. No.
Okay. All right. Trinity, are you happy with what you heard?
I am. I'm optimistic. I am.
Right on.
As far as things coming up, I don't have my phone on me, so I don't have the thing. But
your phone is over there.
The Orange County Drug Free Coalition's annual recovery walk has been rescheduled for tomorrow.
Oh my God, we didn't see that. Yeah. The recovery walk is tomorrow.
But it's at a different location. It's no longer at.
Where's it at?
I don't have it in front of me. It's on my phone. Yeah, you have to check your email.
Oh, awesome for that, Trinity.
I don't have it. Sorry.
But where can they go? Do you know?
You were charging
you're part of the social media committee.
I wasn't there for when they came up with all the plans. I missed the last meeting, so I found out when everybody else found out where it was at. So
sound like blaming excuse making to me. I mean, it sounds like you didn't make a phone call.
Whatever you want.
You didn't make a phone call to find out where it's going to be.
You were correct. I did not.
Anyway, I think that you can go to what is that? Eventbrite, and look up "Step in the Name of Love." Go to Eventbrite, look up "Step in the Name of Love" Recovery Walk 2017.
Yeah, I hope they've. I think
Any of those words,
updated.
search those words, and you will find it. You will find it's tomorrow, and Trinity and I will be at the Recovery Walk tomorrow. Robbie, you going to go?
Not sure yet.
Okay, all right. So we'll be there at the Recovery Walk again. Thank you very much to I can't stress enough how grateful we are to Retreat Premier Addiction Treatment Centers and Journey Pure, two facilities that I think are very good facilities at helping you out, even if you're just kind of having questions about this and trying to see if maybe you or your family member needs recovery or needs rehab or that level of care. First of all, these places all have all levels of care, all different kinds of levels of care, and they have partners all over the country that if they're not the right fit for you, if your issues kind of require some other kind of services, they will help connect you. They're not just going to, we can't help you and hang up on you. That's why we don't use those kinds of facilities on this program, and that's why we don't recommend to those facilities, because we only recommend to facilities that we know are going to take your hand from the beginning and all the way to the end. You can go to nowmattersmore.org and you'll get a specific name and a contact phone number. So we will never give you just a 1-800 number or anything like that on this program. We want you to have a direct link to somebody specifically that can walk you through the process. Trinity, you wanted to say something?
I've got it.
What was that?
I went to eventbrite.com and I looked it up.
I told you.
It is tomorrow, the 28th, from 8 a.m. to 12 p.m.
Mm-hmm.
And it is at the Dr. Sylvester Hankins Park in Orlando.
There you go.
So that's Dr. Sylvester Hankins, Hankins, Park in Orlando.
See, I just had to help Trinity resolve the question. He was just giving up. You saw the way he was just like, I didn't go to. You know what? I didn't go to the meeting either, but I did know that you have to go to Eventbrite.
Yes.
A little pat on the back for Louis.
I'm sorry. Who brought it up, by the way? Who completely forgot it, and who brought it up?
He can try all he wants. But anyway, my daughter's birthday is coming up. 16th birthday. Sweet 16 is coming up. Yeah, November 1st. Zoe is 16 years old.
Wow.
Has been just talking about a car. That's all she's talking about. So if you're out there and you want to donate a car to Zoe, if you feel like Zoe deserves a car, then you could feel free to give me a call and just give Zoe a car. I'm good with that. So David Moss, if you're listening, if you want to give Zoe a car, you just give her a car. Right? I'm not going to say no to it.
I wouldn't either.
All right, again, thanks very much to all of our partners. Thanks to Aquarius 7 Broadcasting. Thanks to WJHM102jams.com, Rock100DIZ.com, and, of course, Surf Monkey Media here in New Smyrna Beach, and all the good people at the Problem Solving Network, WPSN99.com. From all of us here at the Couch Live, adios, amigos. It's time for a taco. Goodbye.